All right, Ms. Fallon, you've been a patient here for some time now, and can you remember back to what was your chief complaint that brought you into care in the first place?
I was having tingling in my wrists and fingers.
And that's not good.
It's not good because I'm a dental hygienist.
Yeah, that's
and
your
I need my
livelihood.
fingers. Exactly.
Yeah, so that's a serious deal. Well, how long had you been dealing with this?
For probably about 3 or 4 months before I started.
3 or 4 months. And then what had you been trying to do to resolve this problem before you started care here?
Well, outside of work, I was trying to stay away from using my phone all the time and wearing a brace on my wrist.
Mm-hmm.
Trying to do some extra stretching and
Mm-hmm.
stuff, but none of it was working.
None of it was working.
No.
And so, what was your experience when you started care in this office?
To be honest, after the first 2 or 3 visits, I haven't had that feeling anymore.
And that's been some time ago.
Mm-hmm.
Well, that's
Okay.
fantastic. It's been a long time. So that's not what's bringing you in for care now.
No, I don't want it to come back.
Okay, it's preventative care or
Yes.
proactive care. We were talking about this, and this is something that you stress with your patients: proactive care
That's right.
rather than reactive care.
Have to have proactive.
Yeah, that's right.
Yeah.
Well, listen, I appreciate you sharing your story. So, if anybody is watching this video, and if you have similar concerns as Fallon, or maybe you don't have any symptoms and want to be more proactive with your health care, give us a call. Chiropractic may be the answer for you. Our number is 803-943-3748. And Fallon, thank you for sharing.
Thank you.
All right.